Done.
Okay, here we go. This is part 2 of the complete physical assessment. This is the anterior chest and the lungs and the heart. We're going to first observe the skin and the muscles and the respirations. Inspect for any obvious pulsations or any heaving. I'm going to palpate the chest wall and the pericardium and the point of maximum impulse. We're also going to check the lymph nodes. I'm going to check the subclavian, central axillary, brachial, and the axilla lymph nodes. And let's see. Oh, you lean forward. I'm going to also percuss for resonance bilaterally. Percuss down the chest. Lean forward a little bit. There we go. Okay. And then I'm going to auscultate for breath sounds from side to side. Deep breath and out. And again. Okay. Okay. And his lungs are good and clear. And we're also going to auscultate the heart sounds. Just flip your chair back toward me, please. We're going to listen in the aortic area. Palm on it. Tricuspid. Mitral. And apical area. Okay. And we're also going to check the breasts. We're going to inspect them in all 4 positions, setting up straight with the hands at the side, behind the head, on the hips, and leaning forward. Palpate the breast tissue by just doing simple chest wall sweeps or by manual digital palpation in a systematic motion. Let's see. We've done part of this. With the heart, we're going to inspect the precordium. Have a bright lamp and just to shine it across the chest. We have the patient recline, just lean your chair back, at a 45-degree angle, and inspect the precordium for any type of unexpected visual pulsation. The jugular vein, we would also test that for jugular venous pressure and estimate that. It would be the 2-ruler test. We have one ruler toward the mid-axillary line and toward the jugular, and you would estimate that. Let's see. I think I've already said this, but with patient laying supine with chest exposed, you would palpate the chest wall for any thrills, heaves, or obvious pulsations. And as far as auscultating the heart sounds, it's a little bit better to have them lie on their left side because the sounds are better heard, and then you would auscultate again so that you could hear the sounds better. Abdomen, it's better if you have them lay supine, but we're going to have him recline here in this chair. We're going to inspect the abdomen skin, the characteristic color, contour, check for any obvious abnormalities. Brack has had about 6 different abdominal surgeries, so he has very large areas of scarring. He has actually had 6 hernia surgeries and several mesh replacement surgeries as well. We're going to start out by auscultating the vowel sounds in all 4 quadrants. And then with the bell or the stethoscope, we're going to check for any venous hums or breeze over the the renal arteries, the aortic arteries, the iliac arteries, and femoral arteries. Okay, and we're also going to percuss the abdomen to check for any sounds of resonance, dullness, or tympany. Okay, and we're also going to percuss to check the liver's span. Start at the right mid-clavicular line and percuss down until we hear some dullness, and then we're going to percuss back up, and then we're going to mark the liver's span. We're also going to percuss on the left side of the mid-clavicular line, and until we hear the splenic dullness. See, also for the abdomen, we're going to palpate with light, moderate, and then more deep palpation. And Brack has quite a bit of scar tissue from his conglomeration of surgeries. We're also going to palpate for specific organs, such as the liver, underneath the right costal margin, spleen underneath the left costal margin, the kidneys. Just stay where you're at. Put one hand behind the back. Try to progress for the kidneys. It is harder to do on a larger adult. And then also for the aorta, slightly left of the mid-clavicular line to palpate for the aorta. Let's see. The abdominal reflex test. Stroke up and out for the upper quads and down and out for the lower quads. He has a lot of decreased sensation, so this test doesn't really work on him as well. And then we would also assess the inguinal area, and we would palpate for the inguinal lymph nodes, also for femoral pulses. And then another thing that you can do to check for hernias is you can kind of just lift his head up off the table and examine his abdominal area and assess for any hernias or abnormalities that way. Any thinning of the abdominal wall. As far as musculoskeletal system, it's better to have him lie upon, but for illustration purposes, we're just going to have him recline in the chair. Also, again, observe any skin characteristics or changes. Going to palpate the temperature of the extremities, and we're going to also check for any type of edema. We are going to check pulses. Check his femoral pulse. Check his popliteal pulse. His posterior tibial, and then the dorsal pulse on top of the foot. And all his pulses are present. And we're also going to test the range of motion and ankles of the feet and knees, and we'll do that in just a minute when we assess his gait. We're also going to check the hips for stability and do range of motion and strength tests on that as well. And as far as other musculoskeletal functions, we will also check his coordination and use of movement, use of muscle movement. Let's see. All right. Here's another yellow. Says that when we get to the spine section. All right. As far as the neuro, we're going to do the sensory. I'm going to get my little tuning fork test here, and let's see. You're going to close your eyes for me. You're going to tell me where you feel it buzz, okay? Feel it buzz?
Mm-hmm.
Where's the buzz?
Where's the buzz? In the middle of my forehead.
Okay. Okay. All right. and let's see, we're also going to check your vibratory sensations. Just tell me where you feel it buzz.
Yes.
Okay. Alright, and then we would also do that on the lower extremities. Let's see, paper clip. We're going to do the discrimination test, and you're just going to tell me if you feel 1 or 2.
2. 1. 2. 1.
Okay, that was actually 2, but that's okay. That's normal. Alright, and I'm going to check for diagnosis and graphesthesia. We're going to have you identify an object with your eyes closed. Okay, turn your palm up. An object in your hand. Close your hand. Feel it. Tell me what it is.
Oh, that is a cotton ball.
Okay, very good. Keep your eyes closed. And we're going to trace something in your hand and you're going to tell me what it is.
8.
Okay, very good. Alright, so we're going to also assess your motor and coordination. Hold off on that. We'll do that in just a minute. I want to assess your deep tendon reflexes before you have to get up. So you want to check your bicep. Okay. Your patellar. And your Achilles. Okay. And then we're going to check your reflex on the bottom of your foot. Check the plantar set. Yep. Okay. And use negative for Babinski sign. Let me put your foot down. Alright. And we are going to I'll have to conclude the segment and do the coordination and spine test. Well, assessment.